ಹೌದು ಇದೆ ಇದೆ ಖಂಡಿತ ಸರ್ ಆಯ್ತಾಯ್ತು ಆಯ್ತು ಸರ್ ಓಕೆ so the protozoa are difficult to eliminate completely because many times they are lodged in the liver and also transmitted by the ticks, tsetse flies, and the mosquitoes and other arthropods. And these multiply by proliferate rapidly in hot and tropical climates. And also the many protozoal infections are zoonotic, means they are coming from the animal to the human beings and vice versa also. And these type of the protozoa infections many times in the persons who are in close contact with that of the human beings or the animals will have the disease which is uncontrollable. Yes. Then the common protozoal infections of veterinary importance are the coccidiosis, so it affects almost all the animals. Then toxoplasma, which affects the cats. Then babesiosis, then thaliariosis, then cytoxonosis, giardiasis, trichomoniasis, and trips. Then leishmaniasis and amoebiasis. So amoebiasis, many human beings get this particular disease, and it's a very common disorder of the humans. And also amoebiasis is a disorder of the cows, as you know very well. And in the present chapter, we are going to deal with the study the chemotherapeutic agents, means the drugs which are effective against all the above mentioned parasites. So this here is the what you call as the basic structure of some of the, especially the Plasmodium red blood cells, which causes this malaria, then amoeba, then Sarcodiana family, then many of these family, then Vorticella, etc. So basic structure like this. And the anticoccidial drugs are the one which are going to be used for the prevention and treatment of coccidiosis, especially in case of the chicken. Yes, in case of birds, this is highly dangerous and causes the bloody diarrhea and causes the death. Of course, in case of cattle, sheep, goats, dogs, cats, and the other species. So the anticoccidial drugs, they either inhibit the growth of the intracellular coccidia, or they are called as the coccidiostats, or destroy coccidia during their development of the stage, or very similar to that of the bactericidal and bacteriostatic drug. And some anticoccidial drugs may initially coccidiostatic, but may become coccidiocidal later, and they kill almost all the coccidia in higher concentration, not in the lower concentration. And most anticoccidial drugs currently are the coccidiostats. Most of the drugs are coccidiostats. So these coccidia are obligate intracellular parasites belonging to phylum. That's the varieties of the phylum are there, species are there, but here the important phylum are the Apicomplexia, then Sporosia, then subclass Coccidia. So this is the order how they are classified. The majority of the veterinary importance Coccidia are belonging to the family Aimeridae, then the genera Isospora, then Aimeria. So in Aimeria also, once again, so many subclassifications are there. And the Coccidia belonging to the genus Isospora infect the dogs, cats, and man. And belonging to Aimeria infect the Aimeria tenella, etc., poultry, cattle, sheep, and goats. So depending upon the type of the species, once again, subclassifications are there. The list of important coccidia are here. Then there is a life cycle. We should know what is the exact life cycle of a parasite before going to, because they have got the egg stage, adult stage, etc. Then both this, especially in case of egg stage, etc., there in mosquitoes and ticks, and being the eukaryotes, they have got the both sexual and asexual phases. So it begins when oocytes pass in the feces, get sporulated, and are ingested by the host. So always it's a fecal contamination many of the time. And during the sporulation, each oocyst develop into 4 Aimeria or 2 Isospora sporozoites that maintain 2 Aimeria or 4 Isospora species. And some of the sporozoites, thus the oocyst contain total 8 sporozoites. Means the oocyst is the one which is containing sporozoites of the number 8 in the stage. And after ingestion, these sporozoites are released from oocyst and invade the host enterocytes, especially in case of the poultry and the other susceptible animal. So the one side, inside the intestines, once these organisms get entry into the these sporozoites get entry into the intestinal cells, they develop into tropozoites. In the parasitology, I think you know this, all these things, and they divide by the schizogony, means it's a asexual fission to produce many schizons. So schizon is the one of the important stage. And initially the cytoplasm of the schizont is divided, but later on it is broken down into elongated fusiform organisms called as the merozoites. So schizons are converted to merozoites, and the number of merozoites are formed by this process. So the schizont varies, the size, etc., varies from the species of the animal and the species of the particular amoeba. The schizont, when schizont is, especially in the first generation, matures, these merozoites, so-called as the merozoites 1, are released from the cell and infect new enterocytes so as to continue the cycle of the asexual development. So here the sequence of development and the asexual cycle is repeated repeatedly, and it is going to cause each cycle of this conversion from the sporozoite to merozoite, etc., is called as the generation. So accordingly, the generations are classified as first, second, third generation, etc. Then tropozoites, schizons, and merozoites. So they are all numbered. And the merozoites produced by the last cycle of the asexual fission enter another enterocyte and develop into a male or female gametocyte. So initially it is asexual, then it is divided into male and female gametocytes. So the female gametocyte enlarges and forms a singular larger structure within the enterocyte and is called as the macrogamete. So this is called as the macrogamete, the female one. The male gametocyte undergoes the fission to produce many flagellated, that's called as the microgametes. So these are very similar to that of the sperms. So when intestinal cell ruptures, so the enterocyte ruptures, the motile macrocytes fertilizes the macrogamete. So microgamete will be fused with the microgamete, then the fertilized macrogamete, it matures a zygote and subsequently shed in feces in the form of the oocyst. So after all these processes, these microgametes and the macrogametes are going to fuse together to form a zygote. The fresh oocytes are exposed to external environment and they are going to, they will find a suitable conditions whenever there is this temperature, air and moisture are having the optimum conditions. So they will be developed. So whenever there is a congenial atmosphere, they are going to develop and subsequently they infect much more the new infection. So the Eimeria tenella, Eimeria cystis, etc., because of this repeated intracellular invasion and rupture of the intestine, continuous invasion of this thing, and there will be a severe, what you call as the hemorrhage, and there will be diarrhea because there is a lot of irritation in the intestinal cells and they cause the bleeding because of the rupture of the small capillaries. And the mucus lot of mucous membrane is also broken and mucin is produced. So the normal animals in some cases may also develop immunity because after coccidial infection that eliminates the infection even without therapeutic intervention. So this is a self-limiting disease. Whenever particularly after diarrhea and other thing, the these organisms become dormant and get hidden in the intestinal walls. Whenever there is a adverse reaction, adverse condition, then these get developed into the disease. So the anticoccidial drugs are the large number of the drugs are available for prevention and treatment of coccidiosis in case of the animals. And most of the drugs, anticoccidial drugs, are effective against the first and second asexual cycle. So first and second asexual cycle, with a few having activity during the sexual cycle. And drugs act at different stages of the coccidial life cycle and may interrupt asexual stages, then sexual stages, and both. So depending upon the stages. And the drugs are also effective in different stages. Different drugs, we'll see the number of drugs here. And because the cyzones are released following rupture of enterocyte only after a few days, the therapeutic agent must be present in the intestine for several days. That's very much required, usually 14 to 21 days. Then it causes the effective anticoccidial activity. So many of the drugs become toxic if such a long time the cells are exposed, then there is a chance of the toxicity also. Then some of the drugs, anticoccidial drugs, the structure activity relationships. Yes, of course, here also some sulfur methoxin is there, sulfur quinoxylin is there, then dicarbazine, amprolium. This is one of the most commonly used drug. And apart from this one, many other drugs are also like that there, and we'll see what is the classification of these drugs. So in poultry, the coccidiosis is one of the most dangerous disease, which causes severe diarrhea and causes the death. And it causes the drastic reduction in the body weight gain. Then, of course, the egg production is drastically decreased, and food conversion efficiency will also be decreased. And relatively low dosages of some anticoccidial may also be used continuously, especially in favorates, for the development of the immunity. Drugs at the low dosages do not completely eliminate coccidia and allow a degree of parasitic development, enabling the body to acquire immunity to reinfection. So, if a small quantity of the this bacteria is there, then they will cause the low level immunity, and to the subsequent infections, the birds will become resistant. This is concerned, then the prophylactic medication is discontinued from the commencement of egg laying because the most anticoccidial interfere with egg quality. So, and also with the decreased fertility, etc. So, it is earlier this practice was there, but nowadays it is stopped. Then in lambs, cows, and rabbits, the continuous coccidial medication is used during the period of increased rest immediately after the birth. Many times what happens is, in case of cows, rabbits, and then especially in case of cows and rabbits, they develop the coccidiosis just after the birth, because whenever there is a contaminated feed and water, then these animals are so the high dosages of the anticoccidials are usually used for the short duration for the residual effect and the proper treatment, and they should recover. And the generally drugs are used for the prophylaxis as well as the therapeutic purposes are different, because only the therapeutic agent causes both types of the activity. So in low doses, they become prophylactic. In high doses, they may become therapeutic. But there is a chance of development of the resistance also. One need to take care of that thing. And compared to the classification, coming to the classification, the anticoccidial drugs are generally divided into several classes on the basis of the mechanism of action, then the chemical structures. And here you can see what are all the drugs which are used in case of the chicken, because the coccidiosis is one of the most dangerous disease in case of the chicken. Number one, the drug, the first classification is, you can please read it, thiamine or vitamin B1 antagonist, like the amprolium, thiamine or vitamin B1 antagonist, that's the amprolium. And the second category is ino-4 or polyether antibiotics. Example, the monensin, then lasalocid, then salinomycin, narracin, then mudramycin. So this drug is a little bit sweet to hear because the Madura is the Indian name. So the mudramycin and the sumtramycin. So the folic acid antagonists like these, all these are especially the many of the sulfonamides like sulfaquinoxylin, sulfaguanidine, sulfadimidine, then sulfadiazine, the PABA agonists. So sulfamethoxin, sulfamethoxazole, and sulfacorpyridazine. So all these are belonging to the category of the sulfonamides. These are also effective anticoccidial drugs. Then another category, second category is the, depending upon the classification based on chemical structure, the pyrimidines, especially the trimethoprim, and all these drugs belong to the ormetoprim, and sometimes the combination of both sulfa and trimethoprim also. Then substituted benzoic acids like ethoparbate, then potential sulfonamides, example, the trimethoprim and sulfa dimethoxy. So these are all very effective anticoccidial drug. And also the sulfa trimethoprim and sulfadiazine, the popular combination. Then of course the ormetoprim and sulfadimethoxy. Then and many other drugs are also there. Whereas the fourth category is the quinolones. So quinolones, especially the chlorolones and some of the simply quinolones like dicoquinate, then methyl benquinate, and buquinolide. All these are the quinolone. So not like that fluoroquinolones, etc. These are totally different category. Then pyridinols are the clopidol, then guanidines, then robenidine, then nitrobenzamides, dinitromide, then also aclamide. So these are, then the another category is the eighth category is carbonylides, the nicarbazine. Nicarbazine is one of the anticoccidial category. Then quinazolines, example is halofusinone, and some of the other category is also there. Benzene cetanide are example diclarzurazil and clarzurel. Then triazinones, then these example is toltrazuril, then benzylpurines, that is eprinocid, and miscellaneous drugs are there. The nitrofuranzones or furazolidone, then tetracycline, of course the oxytetracycline and the pure tetracycline are important. Among these tetracyclines are compared. Then coming to the first category, that is the thiamine antagonists, especially thiamine antagonists. So here the last one drug, number one drug is the amprolium. It is a structural analog of the thiamine. Amprolium is one of the drug which is very commonly used in case of the rabbits and also in case of the poultry. So it's a structural analog of the vitamin B1, and it occurs as a white crystalline odorless powder, and thiamine is very much required to almost all the animals. Of course, the ruminants are going to synthesize this, and the mechanism of action is, it is a quaternary ammonium compound, just like the aminoglycosides, and is structurally similar to that of the vitamin B1. So therefore, it is going to mimic the action of thiamine and competitively inhibits the thiamine utilization by the parasites, because thiamine is very much required for the growth into different stages like merocytes, sporozoites, zygotes, etc. So this is going to inhibit such cycle, and it mainly acts on the early first generation seizones, preventing the differentiation of the merocytes. And the another Another mechanism is it suppresses the sexual stages of sporulation of the oocytes. Then another thing is the prolonged high dosage of amprolium can cause the deficiency of the thiamine, especially in case of hosts. So this can be reversed by addition of excessive thiamine in the diet. So these thiamine antagonists, they are non-specific. Either they will also act on the thiamine utilization in the hosts like the poultry, then in case of rabbits, etc. So they may cause severe thiamine deficiency. So combat this thing, the food is added with the additional quantity of the thiamine or vitamin B1. So this is the structure, and the amprolium is available as a soluble powder and available as amprolium 200 gram per kg. So it is, if it's 800 gram is the excipients, then 200 gram is the amprolium sodium. And this is used for the prevention and treatment of the coccidiosis, especially in case of the broilers, then the pullets, breeding stock, the turkeys, ducks, and almost all the birds. This is very effectively used. Of course, the cost of this drug is also very high. Like the structure is having this structure is similar to that of the thiamine or vitamin B1. Then coming to the antiprotozoan spectrum of this drug, it has got a very good activity against E. tenella, then many other varieties of the Eimeria species, and has got moderate activity against the varieties of other species. So in case of cattle, the species of the protozoa that is going to act is E. bovis, and the another thing is E. zurni. So it is very effective, and it has comparatively less activity against intestinal coccidiosis than the cecal coccidia. So you may be knowing there is a difference between the upper intestinal coccidiosis and the cecal coccidiosis. So it is often used in the combination with other anticoccidials like the ethopavate to improve the spectrum, means the spectrum of activity will be widened. And as its action is predominantly on first generation seizons, the amprolium has significant prophylactic properties. And resistance to amprolium develops rapidly in the susceptible coccidia. And coming to the pharmacokinetics, the detailed pharmacokinetics is not available, especially in case of animal, and the drug is poorly absorbed after oral administration and is mainly confined to the GI tract. So the side effects of or adverse effects of the drugs are the amprolium is one of the safe drug among all the other drugs, even though the efficacy is also of course it's satisfactory, and about 8 times the recommended dosage. So if you administer it by oversight 8 times, then nothing is going to happen. So in case of dogs, the neurological disturbance, depression, anorexia, and diarrhea have been reported, but the signs are not so very frequent and serious. So the excess dosage of the amprolium may cause the polioencephalomalacia, because this is the one which causes the CCN means cerebrocortical necrosis in case of the sheep and also in case of some of the cows. Then it inhibits the production of the erythrocytes, especially in case of the cows. So then the treatment of the amprolium toxicity, especially it is treated by administration of the vitamin B1 or the thiamine. So the dose is 1 to 10 milligram. Always it is required, IM or IV. So thiamine is very much required, and continuous depletion of the thiamine causes the brain disorder, polioencephalomalacia, or the birds will start the stargazing posture. And contraindications and precautions, as such, there is no absolute contraindication. It is not to be used for more than 12 days in case of the puppies, or else it causes the deficiency, but it can be treated. And amprolium should not be administered concurrently with thiamine because there is a this antagonism, chemical antagonism. Directly they are going to have bond with these things and should not be used. The clinical use of this amprolium, so this drug is used for the prevention and treatment of the coccidiosis in poultry and cattle. So it has been used in the dogs, swine, sheep, goats, and for the control of the different type of the coccidiosis. Sometimes it is intestinal, sometimes hepatic coccidiosis is also there. And but it is the disadvantage is it has poor efficacy against the Emeria species. So it is used with folic acid antagonist like ethoparbate or sulfaphenoxylate. Then it has got the additive activity. So this is available this alone or a soluble powder, like it can be put in the drinking water and also the feed premixing. Usually amprolium is a compulsory drug in case of feeds because the poultry feed, and it has got 0-day pre-slaughter withdrawal time. Means especially this is very important in case of poultry, that the withdrawal time should be strictly followed there because of the drug resistant and drug residues are concerned. Then the dose of this drug, the amprolium, 5 mg per kg orally for 21 days. So you cannot expect the immediate recovery. It requires such a prolonged treatment. And dogs also, it is required very high dose, that's the 100 to 200 milligram. Then for 7 days it's required. Then cats, 6 to 100, cattle for some of the adult cattle. Then 10 milligram for 5 days, some of the things for the treatment. Whereas the prophylactic, the very low dose, that's the 5 milligram is required. And double the dose is the therapeutic dose. And the swine, it is 25 to 60 milligram. Then poultry, of course, it is 0.012 or the double in case of water for simply 3 days. And the combination mixture, especially it is combined with that of the ethoparbate, and the ethoparbate combination is somewhat more popular when compared to the single drug. Then polyether inophore antibiotics, polyether inophore antibiotics. So these are fermentation products of the Streptomyces species, and they are widely used in prevention of the different type of the coccidiosis, maybe in case of poultry and also in case of the cattle, especially the small cows within the age group of the 1 to 2 months are highly susceptible. And some agents also possess the growth promoter properties. Yesterday we have studied what are all the growth promoters. And these are used in the beef cattle. So the mechanism of action of the inophore antibiotics, they have got the affinity for the cationic type of the drug, especially in case of the sodium, potassium, or calcium, and form the lipophilic complexes with them. And the inophore cation complex renders cell membrane permeability to the cations, and they cause excess entry inside the cell. So this is the mechanism, the excess quantity of the drug entry inside the cell and it causes the mitochondrial dysfunctions, especially the substrate oxidation and ATP hydrolysis in the susceptible coccidias species. And the alteration in membrane integrity, etc., causes the lysis of the cell, and the specific ionic imbalance occurs. So the different inophores may have different affinities, like they are effective against the cations, means positively charged ions like sodium, potassium, then also the calcium. So this coccidial resistance may also a common property, but here it is not so common. Usually it is slow developing when compared to the bacteria and virus. Few of the polyether inophoric inophores are the salinomycin or the narasin, and many of the drugs are belonging to the category as lidelomycin, then lysocelin, then instamycin, then lasalocin. So these are the different structures. Then antiprotozoal this spectrum. So these are effective almost all the species of the Eimeria. So this amprolim is not effective against the varieties of the Eimeria in the lower doses, but in combination with these drugs, it may be effective. It is also effective against the sporozoites, merozoites, then the other stages active. So these do not have the interfering capacity with the development of immunity to protozoa and are considered useful replacement, especially in case of the litters. The deep litter system birds do have lot of chances. If one bird is affected, almost all the birds are affected. Hence, the antiprotozoal drugs are always used them. Kinetics. So this is not available as usual. It's erratic also. The side effects, adverse effects. So these inophoric antibiotics have got the low margin of safety, means the toxicity is high. Equines and turkeys are highly susceptible to inophores, then even at the lowest doses. And these drugs cause severe cardiovascular effects and fatalities in case of horses, just like few of the anti-inflammatory analgesic agents, they are also toxic to horses, and these are also having very high toxicity to horse or the equine species. And high concentration of calcium in cardiac and skeletal muscles are responsible for the toxic effects of these drugs, especially in case of the animals. Hence, some inophores depress weight gain. Some inophores depress weight gain when in the absence of the coccidial infections. These drugs are contraindications in certain conditions, especially as it is told earlier, the equines it is fatal, and they should not be mixed with other anticoccidial drugs. And the 7 days, these should not be given with the administration of another drug, that is the thiamulin. It is a antimycoplasma drug, especially CRD. Then clinical uses are primarily used for the prophylaxis of the coccidiosis in chicken and cattle, the same like that of the amprolium. So may be fed continuously to be effective as birds, and the field may be picking up. That's the infection all the time, because in the deep litter system, the birds are very much susceptible for recurrent infections or reoccurrence. And these drugs are generally not recommended for the already established infection, just for the prevention. And some of the inophores used also as the growth promoters, actually we have seen. Then the monensin is a monovalent polyether antibiotic obtained from the fermentation product. So the so it is highly infective against all species of the coccidia, especially in case of the different coccidial parasites. Then monensin is one of the drug, and there is a one of this anti-coccidial resistance or coccidial resistance is recorded now, becoming widespread, because the irrational use of this monensin by the poultry farmers is one of the meanest now. Then it is used in the broilers only, then cattle and sheep. So it is also sometimes used as the growth promoter in cattle. So this is not recommended for the layers because the eggshell, etc., will be hampered growth of the eggs, formation of the eggshell, etc. And the horses, turkeys, and guinea pigs are very sensitive to monocin and must not have access to the monocin containing diet. The LD50 is very low, means it is margin of safety is very, very less. That is 2 to 3 milligram when compared with the 200 milligram in case of the chicken. So that's why the chicken are very much, these equines are very much susceptible. And the combination of the monocin with other anticoccidial agents should always be avoided. And the pre-slaughter withdrawal period is 72 hours in case of chicken. And of course, no withdrawal period is required to goats. And the monensin, it is available as a salt. Monensin sodium is available. Then the prophylaxis, it is used in the case of chicken, cattle, and goats with the varieties of the doses ranging from 100 to 200 and 100 to 360 grams of the feed. Lasalocid is another drug. Lasalocid is a divalent polyether antibiotic used by the Streptomyces lasallensis. So like monensin, it is widely used for the prevention of the coccidiosis, especially in case of the chicken. Then this drug it is not administered to the other breeds of the birds, especially the poultry, etc. They are not very commonly used in this particular category. And it's a polyvalent divalent ionophore. It interferes with the metabolism of the cations like the sodium, potassium, etc. It may cause the severe deficiency disorder. Then this drug need to be used very carefully in case of especially in case of young pullets, because it is transmitted to eggs and hens. Then the dose of this drug is of course the chicken 75 to 125 per gram of the feed is concerned, and the cattle it is 1 milligram per kg body weight, and cattle it is 1 milligram per kg, and maximum dose is 360 milligram, and the sheep and goats is sheep, especially not the goats, 50 to 70 milligram. So this drug especially is used especially in case of chicken, cattle, and sheep only. And salinomycin, it is a monovalent polyether ionophore obtained from the Streptomyces albus, and it is very effective against the sporozoites and early and late asexual stages of the chicken coccidia. And like monensin, it has the broad spectrum activity against all species of the Emeria in case of the chicken, and salinomycin is approved mainly for prevention and treatment of the coccidia. And unlike monensin and lasalocid, the pre-slaughter withdrawal is not required to this salinomycin. And dosage is usually it's a pre-mix, that's 60 gram per ton of the feed, especially, and replacement layer to chicken, it is used as the 40 gram per ton of the feed, and the narasin is monovalent polyether ionophore antibiotic obtained as a fermentation product of the Streptomyces aureofaciens. So the aureomycin is also obtained from the Streptomyces aureofaciens. So it is structurally and pharmacologically related to salinomycin. Then it is approved only in case of the broiler coccidiosis, and need not have the pre-slaughter long withdrawal period. It is toxic to horses and also should not be given to turkeys or game birds. The dose for the prevention of coccidiosis, it is broilers, it is 70 gram per ton of the feed. Then this is the structure of the narasin. Then this is madramycin, is a very commonly used drug. If you go to the poultry industry, you need to learn a lot, especially the different drugs used in case of the poultry, because whenever you are going to export the drug, export the poultry meat, each country has got its own rules and regulations. Some countries, they will not accept the birds with the traces of the anticoccidial drug. So this is obtained from the actinomedula, that is MNC. So that's why it's called as the meduramycin. So more potent than that of the ionophoric antibiotics, and is approved for the prevention of coccidiosis in the broilers. So many trade names are there. In case of poultry industry, this is a very big business. So different companies manufacture in different trade names like Supercox and many more. So this has got some adverse effects on the growth, especially the feathering problem. There is feathering problem, and administered slightly above the recommended concentration, then it causes the toxicity. So the withdrawal period is 5 days. The broiler prophylaxis 5 grams per ton of the feed. So this has got a little bad odor, and many times especially the birds will eat because they don't have any taste capacity, etc. So meduramycin is used very commonly in case of the this broiler industries is concerned. Then femduramycin is a semi-synthetic monovalent amyloglycoside, monoglycoside ionophore obtained from the Actinomedula piscifera. So it is approved for the use in prevention of coccidiosis in broiler chicken. The pre-slaughter withdrawal is not required, and varieties of the trade name like this Vax Plus and other thing, they are obtained by the different pharmaceutical companies. The broilers, it's 25 gram per ton of the feed. And folic acid antagonists, number one, the sulfonamides. We need not go in detail because in sulfonamide category, we have learned in very detail. So the use of these sulfonamides has declined in chickens, mainly due to the development of the drug resistance, because as and when the sulfonamides were obtained from Prontosil in the 19th century, then a lot of the misuse of this drug occurred, and nowadays the better availability of the other drugs are there, and they occupy the major part of the treatment in case of small animal, the small ruminants, sheep and goat. So especially these mechanism, so it's a PABA analog and competes with the especially the para-aminobenzoic acid for the synthesis of this folic acid in case of the birds, and it is required for synthesis of RNA and DNA also. Then inhibition of the PABA by the sulfonamides impairs protein synthesis. Then also the growth of the microorganisms like coccidia is inhibited. Then the clotrimazole, it is the structure of the sulfonamides, and we have studied it in detail because the sulfonamides have got very similar structural similarity to that of the para-aminobenzoic acid, and the para-aminobenzoic acid is very much required for the synthesis of this folic acid or dihydrofolate. So that's another thing is the dihydrofolate reductase enzyme is inhibited by the trimethoprim. So sequential double blockade is important mechanism here, and hence the sulfonamides are effective against the second generation seasons and have lesser activity against the early asexual stages and sexual stages of the coccidia. And sulfonamides are primarily active against the intestinal species of Emeria. Then also, but nowadays because of the resistance, etc., very high dose is required. And the sulfonamides do not interfere with the immunity development of the animals, especially against coccidia. And sulfaquinoxaline is the sulfonamide used primarily as the anticoccidial drug. So this is effective against the intestinal coccidia, and also the cecal coccidia, of course, is less effective. So it is usually sulfaquinoxylin and amprolium. They are the amprolium is the antimetabolite. So this is available in combination with that of the amprolium, and the sulfaquinoxylin may be used in case of the all species of the animal. So the withdrawal period is 5 days. So this is very much important. So tomorrow, if you enter the poultry industry, then you need to study all the withdrawal periods, the dose, toxicity, etc. Because you are going to administer the dose of the drug to a very large quantity of the birds, maybe 4,000, 10,000, and lakhs together of the birds. So a slight variation in the drug may suppose if a one bird decreases the weight by 10 gram also, then if there are about for 4 or 5 lakh birds, then just calculate the total loss to the owner of the farm. Then sulfaquinoxylin is available as oxidilin sulfur diver mixture, and thousands of the pharmaceutical companies are manufacturing especially the anticoccidial drug. It's a very big industry. Then prophylaxis, parts per million, 125 parts per million. Then cattle, 13 milligram per kg can be given orally. So the coccidiosis treatment, 500 parts per million in drinking water for 8 weeks, long period, and lambs for 2 to 5 days. So other sulfonamides which are used in the veterinary practice for the treatment of the coccidiosis in chickens, dogs, and cats, especially in case of ruminants, varieties of the drugs like the SG, sulfaguanidine, SD, sulfadimidine, sulfadiazine, methoxsane, sulfamethoxypyridazine, and sulfachlorpyridazine are different type of the drugs. And many of these sulfonamides are used in combination with other drugs and are available in different formulations. So already we have studied the structure-activity relationship, the mechanism of action, the side effects, then the adverse drug reactions, the toxicity, etc. In the sulfonamide chapter we have learned. Especially this is going to cause the folic acid deficiency and sometimes causes the crystalluria, and also sometimes the anemia. Then the treatment of the coccidiosis as usual 0.05%, and the dogs 50 milligram per kg, and the chicken usually the drinking water 0.1% is put for 2 days, followed by the reducing dose of the half for another 4 days. And in case of the chickens, the sulfachlorpyridazine is used as 0.03. Only for 3 days it's enough. Then pyrimidines. So already we have learned that the agents, especially in case of the earlier chapter, in the chapter 61 of the Sindhu book, we have learned that these are highly selective inhibitors of dihydrofolate reductase enzyme involved in the synthesis of the folic acid synthesis. And these drugs are mostly used in combination with the sulfonamides, but are also available for the treatment. But these drugs are always combined with that of the sulfonamides. And trimethoprim, of course, sometimes it is used alone, or sometimes it is used in combination. So dihydrofolate reductase enzyme inhibitors are one of the substances which causes the folic acid synthesis inhibitor. And trimethoprim, we have learned already that it is absorbed readily after oral administration, and peak plasma levels 1 to 4 hours of the dosing will occur. And the trimethoprim widely distributed body tissues and excreted mainly as unchanged in the kidney and also the urine. Then important adverse effects on trimethoprim includes the myelosuppression or the bone suppression. In case of small animal, nausea, vomiting, etc. are seen. Then rarely this megaloblastic anemia may also occur, but If you administer this folic acid, then it is not a problem. And several formulations of the trimethoprim are available with the sulfur drugs. It is available as the Bactrim bolus. It's one of the most popular bolus, like the Roche pharmaceutical. It's going to manufacture this drug. So usually it is in the combination of the sulfamethoxam and trimethoprim. If it is 800 milligram, it's sulfamethoxam. Then okay, okay, okay. So the Bactrim bolus is one of the most popular bolus. Then pyrimethamine, it is used as one of the drug that they usually anti-malarial drug, pyrimethamine. Then pyrimethamine is used in veterinary medicine mainly to treat Toxoplasma gondii in case of the horses and also the protozoal myelitis. And it causes the action of inhibition of the same thing, dihydrofolate reductase. Of course, it crosses the blood-brain barrier and accumulates in liver, kidneys, and spleen. So the pyrimethamine, it is used as the anticoccidial drug. This is used, one of the important disadvantages is the pyrimethamine is not approved for the food animals, especially sheep and goat, etc. Of course, it can be used in the cattle. So the dose is the treatment of toxoplasmosis. It is used as 1 milligram per kg orally for once daily. And the cats, especially the toxoplasmosis, is a problematic disease in case of cattle. That is transmissible disease, a zoonotic important disease. So it causes the blindness in case of the human beings. So other pyrimidines are also important, like a few of the drugs which are combined with that of the sulfonamides. And tomorrow onwards, we'll see the substituted benzoic acids like ethopharbate, etc. Then